Welcome to the program. Likewise, also for you, Dr. Imamu, joining us via phone as well. Gentlemen, it's a pleasure having you both in the studio. And, well, regarding this initiative, first and foremost, welcome to the program.
Thank you, Callaghan, and Karen, and all the reporters from Kalang FM who have given me the opportunity. I also like to thank the sponsors of this program. This is one of those very important programs that brings out the messages and interaction between decision makers, implementers, and policy drivers in every sphere of our society. So this is a wonderful program, and thank you for inviting me to this program. And on behalf of the people which have just recently served as member for Kandep, and all our people, once again, thank you.
Dr. Imamu, you there as well?
And so in those interactions, we had discussions as to what they do, and so one of the things that they have been doing is to provide medical treatment to rural hospitals. And so they reached out to Kandep District Hospital and, for that matter, all of Kandep. And so as a result, what we did was that we've asked them to come on board. And so when they came on board, we've made them to come and see the facilities that we have and what kind of medical needs, particularly equipment and all that, for the hospital. Kandep District Hospital was used to be an old health center, and it never functioned for almost quite a good number of years. I think almost 11, 12 years. It was not functioning. It just made redundant. Nobody worked, and most of the patients had to drive all the way to Wabek and Mendi and other districts like Kujib, Chumbu, elsewhere to get medical help. And so as soon as I got elected, with the assistance of the Enga provincial government and the Enga PHA, we renovated the old hospital to district hospital standard. Almost in excess of $1 million kina was spent for that renovation. As soon as we renovated and the renovations was complete, we found out that we didn't have the equipment, and so.
Oh, okay. So.
Man. And then so we needed. Where do we find the equipment? Things like most of the equipment that the hospital has. We found out that we didn't have any, and so that made me to then start reaching out.
So it's like you actually built something from scratch again. It's like you're starting all over again.
Yeah, that's correct. You just have to tell the people of Kandep, we absolutely nothing. They allowed to go into ruins, and so the people had to then fend for themselves and ended up everywhere. So so that's a bit of a background. And so as a result, we reached out to a travel foundation who are doing some work. We also reached out to some other friends in Australia and all of that to try to help us with the types of equipment that we needed for the health center. So, and so the Travel Foundation then told us that we just can't bring you anything. There's so many things to contribute, but we can't bring them because we might bring them and you might not need them.
Yes.
So that's resulted in the assessment team coming,
that's
where
right.
the two doctors came from America. And the two doctors came from America to do their needs assessment, to see what they could bring across for us. So the arrangement was that we provide the money for the receiving and the travel cost, and then they would provide all the equipment for free. They would do the fundraising and buy the equipment and send it across.
You had to take care of just the logistics.
Yeah, we just needed to take care, and I think it needed about 150,000, which we said we've got it here for all of that.
Wow.
And so, so that was the arrangement, and so the two doctors came in to do the needs assessment, and by the time they came, in the meantime, what I did when I was there, with the help of Dr. Imambu and Inga PHA, and of course the provincial government, is that after the health center was maintained, then we had to find equipment. And so,
That's right.
we had some donation from Sopos Hospital
Yes.
through Dr. Lino and his team when he was
When he was there, yes.
yeah, and so he also became a member, and I
That's
said,
right,
look,
that's right.
you're a doctor, so we need some equipment. So they gave us some old beds from Sopos Hospital.
Great.
And then we had to then literally buy just about everything in that hospital. Now it's a fully kitted district hospital. We've got all kinds of scanners to X-ray machines to just about everything. And Dr. Imambo is the man in charge of all of those things. And so I've entrusted him with this, of his expertise and all that. And so he decided to order a lot of things out of China and elsewhere where we need it. And so there's quite a fair bit of new equipment in the hospital. The hospital is functioning very well. It's got 24 hours electricity run by solar power as well as standby generators. And we got over 46 staff members working. And the only major problem lately is and the doctor who can explain some of these things, and lately is the lack of staff houses, because there's more staff members, but we don't have houses. So I started building over 10 new staff houses for the hospital staff, and the construction's going on. And so that's what we have done. So in between, when we were doing all that, the two doctors came after the needs assessment. So after they came and went back,
Yes.
they must have gone and raised some money through their Rotary Club or something. And I didn't even know that that's what was happening. Then the president of Travel Foundation, Mr. Gary Bastin, calls me and says, look, as a consequence of all the efforts we put in, and I think publicly I'd like to say thank you to the two doctors for the initiative they've taken. I also like to thank Gary Bastin and Travel Foundation for all the good work they've been doing to help us in those kind of places where we need those kind of equipment. Some of the equipment that we've sourced are things that we don't normally find very easily in the country. And so I'd like to really thank the two. They've gotten us by surprise. A sort of a surprise present.
It's a nice surprise.
Unfortunately, it came at a time when they didn't know that the man who initiated the thing had just been removed.
Yeah.
So it doesn't matter. I think the our relationship that we created has borne fruit, and as a result of which we got those two, got that very important equipment. And I think the doctor will share some of his experiences with that, the butterfly scanner.
That's right. Now, Dr. Imambu, regarding the butterfly ultrasound device, how useful is this in terms of your everyday operations at the hospital?
It's a random facility. We have just started, I came in on April 2019. That's when I transferred in. Because formerly I was working with Alfred Limited as a clinic supervisor at a Heights clinic. That's one of the facilities owned by Alfred. But when I moved in, there was actually nothing that I can see. The roof was just empty. There was no bed. The buildings were all run down. The staff, even though new staff were recruited, under the restructure of Inga Provincial Health Authority, which was started in 2018. And they brought in staff in 2019 March. But as mentioned, the staff were there, but the facility itself was less down. So thank you to former MP Alfred Manase. He just did it. He just did it, and we woke the sleeping away facility back to life. So he did many things, and then one of them was he helped us maintain the facility to the current level, maintain it to stages where we can operate it. The second thing he did was he tried to equip that facility to operational, meaning without the equipment we cannot operate a hospital or a health service. So he contributed a lot under his leadership, and then we purchased a lot of equipment. And we also purchased a scan machine too, ultrasound scan machine too, but it's a fixed one with a wheel, and it cannot be like the one that was supplied to us by the Christ Foundation, the one that we are discussing. The one that we can just use in the hospital, and it's happy to move around, to bring it around with us too. Okay, the one that was donated to us was is a new brand. I think in India we are the first people to use this one. It's a small one. It's we can just carry it around in our bag, and then it also comes with a iPad. It's just like a mobile. So, it's just like a mobile. But you use the machine itself to scan where you want to scan, and then the picture it appears on the screen of the mobile. Okay, we met a patient. That patient was a mother of 7, and she delivered 2 days prior to our visit, and then she had a retained placenta. So she was the best person to use that machine. We used the machine to scan the uterus, and then we located where the placenta is. And then using the placenta scan as a guide, we manually removed the placenta. The patient survived.
Wow.
So that was the we used the equipment. And then on the same, on that same operation, we were traveling up to another center at another health center called Longa Health Center. And then we had this patient who was most of the time was presenting with heavy gastric pain around the heavy gastric area, the upper part of the abdomen. So it was sort of like a chronic problem, and then we have been treating him, and our staff were treating him for a couple of years, but it's sort of like a recurrent condition.